Leaders in Coney Island are making a big investment in maternal health care. The goal here is to try to address critical disparities often faced by black women in low-income neighborhoods. Hannah Kliger covers Brooklyn and shows us why officials are calling this a shock to the system.
The sledgehammer hits this old wall as a large new project begins at the campus of Health and Hospitals South Brooklyn Health.
We need to invest in the overall health, safety, and psychological well-being of women throughout their reproductive life.
The longtime Coney Island institution begins work on an integrated women's health center in the community. Last year, Brooklyn Borough President Antonio Reynoso allocated $18.5 million in funding for the undertaking, calling it imperative.
Brooklyn is the most dangerous place in all of New York City for a black woman to have a baby. We're talking about black women dying at 8 times the rate as their white counterparts during childbirth.
The center will provide space for labor and delivery, a neonatal intensive care unit, nursery.
We will expand to 30 exam rooms, including bariatric rooms, 3 procedural rooms with restrooms, 6 ultrasounds.
This is one of the old labor rooms, but in about 18 months, this entire floor will be transformed into the Women's Health Center, turning it into a one-stop shop for all in and out patient services.
We've been working at the margins. We give a little bit here, we do a little bit there, and we don't affect meaningful change. What we need to do is shock the system.
For some local leaders, this fight is personal.
When I first gave birth to my daughter, Emily, who's now 10 years old, I almost hemorrhaged. And it was a midwife who made sure that that didn't happen.
Hospital leaders say development of the center will be completed by spring 2026. In Coney Island, Brooklyn, Hannah Kliger, CBS News, New York.
Hannah is a Coney Island native and covers Brooklyn for us. If you have a story idea for her, you can email the address there on your screen.